Well, it's 6:29 right now, everybody. Temperatures in the 30s to mid to upper 30s this morning. We have a specialist in our studio today that deals with retina, diabetes, and all of that. And it's Dr. Wright Lauten, right?
Yes,
And you're with the Retina Specialty Institute.
Yes, ma'am.
Understand we have an institute right there in the Hattiesburg area, right?
Right there in front of Wesley Medical Center, actually. I kind of came on today to talk about diabetes and macular degeneration, which are two important diseases because diabetes being the #1 cause of blindness in the United States, people under the age of 70, and macular degeneration being that of those over 70. The biggest point that people in the Pine Belt need to know is that most of these, or the blindness caused by these two conditions, can be prevented with simple screening. Generally, if a diabetic is screened once a year, the vision loss associated with diabetes, again, can be prevented. I generally, when I see patients who come in who've had vision loss, it's because, Doc, I didn't know I had to come in. Doc, no one ever told me it could affect my eyes. And, you know, this is a disease of years. So if your hemoglobin A1C is too high or you're not watching your sugars and blood pressure, it's something that could ultimately steal your vision. As far as macular degeneration, that is a disease of birthdays. You know, it's pretty much understood that by people when they're 65, about 2% of the population has it. By the age of 75, about 18%. By the age of 85, about 45 to 50%. So if people over the age of 65 have their yearly screen, we can catch macular degeneration a little bit earlier, and if they go on to get the wet kind, is something that we can treat in our office and is something that we can save vision on.
Now tell me, is there anything symptomatic that people should be looking for to let them know, hey, I need to come in?
Yeah, that's a great question. Diabetes is very different than macular degeneration. Diabetes generally affects the peripheral vision first with diabetic eye changes and then works centrally. As far as macular degeneration, it kind of starts centrally and moves out. You have a little bit of a gray spot in your dead center vision. The problem is, people when they're over 65, they're not checking each eye individually daily, and so they could be losing vision one eye and not really know it. So without that screening, it can be missed. Diabetes, again, I cannot tell people enough, get your yearly diabetic eye screen.
And that is quite a problem in the Mississippi area, diabetes anyway.
Right, one of the top 2 states in the country per capita, and we have over 300,000 diabetics.
Well, give us a phone number if you would.
Okay, our phone number, our office is 601-255-0736. We're here 5 days a week, and we're happy to help anybody if they feel like they have an eye condition associated with these two diseases.
All right. And that's at the Retina Specialty Institute.
Yes, ma'am.
Thank you so much for coming to be with us today. Don't forget, you can go to WDAM.com and click on programming and on Sunrise. Time now to find out